My name is Emily Valverde, and I'm going to be doing the current findings and research in emotion regulation in adult depression and the effects of positive psychology interventions on this emotion regulation. The first study that I'll be looking at is the Ollinger study, which studied the correlation between adult depression and emotion recognition and regulation, the affectivity of positive and negative stimuli, and the interpersonal problems and the intensity of these problems for the participants. Their methodology included photographs displaying varying emotional gradients, as in going from happy to neutral to sad, the Emotion Regulation Questionnaire, the Inventory of Interpersonal Problems Circumplex, and the Affect Intensity Measure. The results showed that the depressive symptoms positively correlated with inaccurate assessments of anger emotions and the suppression of these emotions. The affectivity of stimuli relies on the emotional attachment of the participant, and the severity of interpersonal problems interferes with emotional regulation. We move on to Chavez, which focused on the comparison of the effects of positive psychology interventions and cognitive behavioral therapy and the reduction of depressive symptoms. Their methodology included the random assignment of either PPI or CBT group therapies and interventions, and a pre and post intervention interview. The results showed that no significant difference in either outcomes. Both PPI and CBT resulted in positive affect and reports of increased well-being. Both therapies were effective in reducing depressive symptoms, but both therapies put together can significantly alter the treatment of these patients. Then there's Lambert, which their focus was to determine whether PPIs can have an impact on physical and mental health. Their methodology included group therapy or focus groups and SV12V2, which measures the mental, physical, and social health of the participants. The results showed that participants reported greater vitality and an increase in their mental and physical health. There was a reduction of negative behavior and physical limitations. An increase in their daily accomplishments was reported over a 6-month therapy period. Then there's Hay and Dial, which focused on the comparison of age, emotional complexity, and emotional regulation in young adults and older adults. Their methodology included following a baseline test in which participants wrote in diaries for a 30-day period measuring their emotional states. They did daily phone interviews that measured mean daily stress, and using the 5-factor inventory, their neuroticism levels were measured, and they were measured by the self-concept differentiation inventory for their SCI, which essentially is their social standing and how they feel in society versus more of an interpersonal view of themselves. The results showed that older adults were shown to move out of high negative affect faster than young adults. Older adults had higher levels of emotion regulation, and older adults experienced less emotional strain moving from one emotional state to the other compared to young adults. Finally, we come to Yamaguchi, which studied the effect of the Positive Emotion and Distress Scale on the treatment of depression and anxiety. Their methodology included emotion-based inventories that were given to university students in Japan, including the above scale, the Emotion Regulation Questionnaire, the Rumination and Reflection Questionnaire, the Affective Style Questionnaire, Positive and Negative Affective Schedule, and Hospital Anxiety and Depression Scale. The results showed that positive emotion-based intervention was more effective than other emotion-based strategies, and mindfulness activities are especially effective against negative emotion and behaviors when combined with CBT. This study demonstrates that emotion regulation and positive psychology therapies are not a singular thing. They are a global phenomena and are revolutionary because they are actually showing results. They are showing results in daily lives and the treatment of adults with depression. While positive psychology interventions are relatively new, the research already shows that it's an effective treatment combined with CBT for emotion regulation in adults with depression.